restriction, right? So again, C2 to 7, where we get on the pillar, C1 we get on the arch, gyro index gets on the pillar on the side opposite where I'm standing. I'm going to get myself lateral fixation, so I'm going to put some flexion to the neck forward, depending on where I am in the neck. Lower down, the more flexion. Laterally flex towards my hand, rotate, and then I would just pull P to A. So that would be our first one there. We can do a seated cervical index pillar push. There would be, I'll go to a chair. We just grab that chair back there.
We got it.
Oh, yeah. Now we have two chairs. Whoops, sorry.
I can vouch already.
Yeah, this is where we're going.
Oh, great.
Seated cervical index pillar push, we can do for rotation. So again, let's have the patient go out on their heels, palms up. So if we were going to do, say in this situation, a left rotation restriction, again, let's just pick mid-cervical. So you do your index contacts, find your spinous, slide out onto the articular pillar. Our different hand is going to stabilize the opposite side. We're going to laterally flex towards our contact. And we're going to rotate the head. We would thrust P to A for rotation. For lateral flexion, very similar, except now when I slide out, I get onto the lateral portion of the pillar, pivot my body more lateral. I'm going to laterally flex the patient towards my contact. And then maybe there's a very, very slight rotation away, but my thrust is now lateral to medial. And for extension, right, extension, same position here. I'm going to take an index contact on the posterior pillar. Okay, so I'm going to take a little tissue pull on the spinous to get on the posterior pillar. A different hand stabilized. I'm going to extend the patient's head back, drop my arm down, just couple a little bit of lateral flexion, get down low and thrust P to A, I to S. Right, for extension.
For the lateral flexion restriction, is there a P to A component?
Again, I mean, most of it, what you're doing is lateral to medial, but is there any P to A? Because you are putting a little bit of rotation, so there is a little bit of P to A, but in the primary thrust is lateral to medial. With maybe secondary P to A.
You'll be on the same side of restriction, the lateral flexion?
Yeah, you've got the same side of restriction for lateral flexion and for extension.
It was on clinic entrance.
Right, then we have a prone, patient is prone. Right, so we have a prone cervical index pillar push. Right. Ipsilateral contact for rotation. Again, so I'm going to stand on this side here. So if I want to do left rotation, this is the ipsilateral side, so we have a spinous to the right, we have a body posterior on the left. So I slide down with an index contact. I'm going to rotate the patient's head towards my contact, and I'm going to thrust P to A. Right?
It's called extension.
That would be rotation.
Oh, rotation.
That would be rotation. We can do lateral flexion. Very similar. You just bring the headpiece up, so it's not so much. You just scoot down a little bit. And now with lateral flexion, again, if you had a left lateral flexion, I'm going to use an index contact, slide down, kind of get in the lateral portion of the pillar. So I slide down a bit further, get myself positioned here. I'm going to laterally flex his head, maybe couple a little bit of rotation and thrust from lateral to medial. Just toes to move too. All right. Let's see. And we have a prone cervical index pillar push chondrolateral contact for both rotation and lateral flexion. So here I'm just going to contact the body's posterior on this side, so I'm going to contact the chondrolateral side, again slide out onto the pillar. Got to get up higher, my arm has to come out. I'm going to rotate the patient's head towards that contact, and I'm going to thrust again P to A for rotation. for lateral flexion. I'm going to slide out onto the pillar, and I'm going to laterally flex the head, maybe couple a little bit of rotation, and then again thrust lateral to medial. That would be all of those. That's all the cervical. You guys want to set up